Alright, so I'm going to demonstrate how to create a cast for the wrist. So suppose the patient has a Colles fracture of the left hand. Normally we need to get our equipment, so these are the material that forms the cast. They have different sizes, and I have the smaller size and the big size, and unfortunately I don't have the medium size, so I think I might have to adjust to use either the small one or cut the big one into a medium size, and we'll figure it out later on. And then we use this to protect the skin away from the cast, and then the bandage at the end. So let's see how this one works. So obviously it's too big, but we can do some measurement first. So normally what I do is to measure it from the mid palm, that's okay, to the wrist, the elbow joint. So about there, and then what we can do after that is we fold it to about 8 to 10 times to make the thickness. So this is the 4th time, and that's the 5th time. 6. We can cut it after the 8th time. Okay, so let's have a look. I think it's a bit too big, so I can adjust it using this one to the appropriate size of the width of these forearms, so I can do that. Alright, this one we don't need it anymore. So let's have a look again. So that's about the correct size. And what we normally do is we need to create a little indentation here for the thumb. Alright, now we can soak it into the water. Before we do that, we may perhaps put this one on first. Okay, and then you soak this into the water. Alright. So I'll ask the patient to relax, and because the cast is forming a protection to the wrist joint, so I'll ask him to relax and do not put any force on the wrist joint, and just let it dry. And then after it dries, we can put this one on. We'll wait a little bit more. So we can see that it's started to dry up, and then now we can start to wrap around. So we normally can make a hole in here for the thumb. Another one. Thumb. Yep. So we need to make it not too tight, but not too loose either. Okay, and then we just tape it at the end, and for the video's purposes, I'll just tuck it in here. Alright, so a few things to check is, I asked the patient to flex the fingers, so yeah, okay, so he can flex the fingers and extend it quite well, and I need to check the neurovascular whether they're intact or not, and we can see great capillary refill, and 有冇話麻麻地啊隻手指尖 and there's no numbness at the tip of the fingers. So they complete our cast.